It's highly unlikely that you don't already know a lot about coronavirus, the global pandemic currently rolling across the globe, killing thousands and infecting hundreds of thousands, including world leaders and movie stars. In fact, we'd bet an hour doesn't go by that you don't hear about some new coronavirus information. But while you've no doubt read plenty of alarming headlines about the novel virus known as COVID-19, you may have missed some of the fine print. We consulted scientific research and medical professionals to gather the facts about coronavirus you likely haven't heard. 1. COVID-19 can live on surfaces for up to 3 days. Sure, you know that you don't want to grab the seat at the coffee shop next to someone who's coughing away, but have you stopped to think about who was sitting at your table before you even as long as 3 days ago? The truth is, coronavirus can live on surfaces long after an infected person has left. A new study from the National Institutes of Health, which has not yet been peer-reviewed, found that coronavirus can live on plastic and stainless steel for as long as 3 days. 2. It poses a greater risk to people with obesity. While it's well known that the elderly and those with compromised respiratory systems are at a greater risk of contracting and dying from coronavirus, less discussed is the fact that obesity and diabetes can also make people more susceptible. Patients with diabetes are more susceptible to severe complications from viral infections of any kind, and as a result, are considered a high-risk population for COVID-19, says Rocio Salas Whalen, MD, of New York Endocrinology. Due to the pathophysiology of diabetes, patients can take longer to heal, putting them at risk for developing complications from the virus. This is true with any type of infection in diabetes. Salas Whalen also points to research that has found that excess weight changes the efficacy of the flu shot. Considering that more than 2/3 of Americans are overweight, that could have important repercussions as coronavirus spreads in the States. 3. It won't diminish in warm temperatures. Since most associate the regular flu season with the colder months of the year, many assume that COVID-19 will taper off as temperatures rise. But Salas Whalen emphasizes that it's not as simple as that. Unfortunately, the virology of COVID-19 does not diminish in warm temperatures, she says. Although the virus may have a seasonal cycle, it is not reasonable to expect a huge decline in transmission due to warmer weather alone. We see the largest decrease in infections when people refrain from being in locations with poor ventilation and/or large crowds. 4. Pets can get coronaviruses. Unfortunately, cats and dogs are able to contract coronaviruses, sometimes with deadly consequences. A 2011 study in the journal Advances in Virology discusses how what's called pantropic canine coronavirus can infect cats and dogs. And a virus known as feline infectious peritonitis can cause cats to exhibit flu-like symptoms or even organ failure. At the beginning of March, it was confirmed that a dog in Hong Kong contracted coronavirus from his owner. There are strains of coronavirus that do affect dogs, typically puppies. Christy Long, DVM, the head of veterinary medicine at Modern Animal in Los Angeles, previously told Best Life. As coronaviruses themselves are capable of rapid mutation, we are always on the lookout for evidence of disease caused by new strains of this virus. 5. 20 seconds of hand washing may not be enough. You probably thought you were pretty hygienic, always careful to wash your hands after using the bathroom and usually before you had something to eat. But as numerous health officials have reminded us since coronavirus really started to spread, there's a difference between quickly running your hands under the tap and really giving them a scrub. And though 20 seconds has been the recommended amount of time to spend scrubbing, even that may not be enough. Be diligent about washing hands appropriately, for 20 to 30 seconds with soap, under warm running water, Graeber recommends. 6. Face masks don't offer much protection from COVID-19. Because coronavirus is transmitted via droplets, personal protective equipment, such as face masks, are not particularly effective at preventing transmission. Since the virus is transmitted as droplets, it is currently not recommended to need to use standard face masks or surgical face masks, or N95 masks, as good hand hygiene and washing is sufficient, says Graeber.